This is Waves, a podcast from APTA Michigan. I'm Andy Wicks. If you want an example of how to keep your career interesting, look no further than today's guest, Dr. Abby Gordon. If you want an example of how to keep your career interesting, look no further than today's guest, Dr. Abby Gordon. She's a pediatric sports physical therapist in Seattle, but that's just one entry in her resume. You can add former PT to professional athletes, adjunct faculty, and soon-to-be-published author to that list. Abby talked with us about her varied career, what led her to where she is today, and how the profession can do a better job of weight-inclusive care. All right. Abby, if you would like to introduce yourself however you see fit.
Hi, I'm Abby Gordon. I am a sports physical therapist at Seattle Children's Hospital, where I just hit 8 years working. I've been a PT for 10 years. I was a APTA Washington delegate for 2 years, which has, I think, been what brought me more into Andy's circle with overlapping colleagues that I met through doing that. I recently joined the new Tufts Seattle program as an adjunct faculty.
Nice.
So I'm going to pick Andy's brain on this about things that we should learn as new academia people.
Shaping minds of our future generations.
I hope
Terrifying, isn't it?
It is.
So your description of yourself, a sports therapist, but your second thing was that you work at a children's hospital, because I'm not a sports therapist. My first thought was like, okay, are you working with the uber competitive kids whose parents put them into dedicated training programs to get them into a specialty athlete kind of a thing, or am I way off the mark here?
I get some of those for sure. We actually have a really wide variety. And I think my favorite part of working in a pediatric setting is that my office has sports physical therapists sitting right next to rehab physical therapists, occupational therapists, and speech therapists. We're all in the same gym treating our patients at the same time. I get to watch the neurodevelopmental things they're doing with littler kids.
Mm-hmm.
I don't really see anyone under age 5, though I have had a 4-year-old with a PCL tear. It was a playground injury.
Oh.
She was adorable and had a cute little walker that they got the fancy tape from Target that had the patterns on it, and they wrapped it around the walker. She called her Cadillac. They were really fun. They'll treat 0 to 21. I won't usually treat until above 5, but most of my patients are teenagers.
Okay.
My patient population is pretty split. It's half post-op knee or just knee pain.
Mm-hmm.
And that's ACLs. And when you're in pediatrics, we do a lot of MPFLs, which is when you're dislocating your patella and then they re-anchor it down. And sometimes they move around bony landmarks, and it's really extensive rehab, very similar process and timeline to ACL. So 25% of my patients have had knee surgery. Wow. And we start on day 3 and we treat them all the way through to 9+ months return to sport.
That is
And
nuts.
then a large percent, maybe 25%, are chronic pain, chronic illness, hypermobility syndrome. I put POTS in there too because they kind of overlap with each other.
Mm-hmm.
So that's half of my patients. And then everything else is a mix: ankle sprains, fractures, shoulder stuff, neck pain, motor vehicle accident. It's a good mix. And I really enjoy the post-op knee patient population, but the chronic pain population has become kind of my favorite thing.
Really? You're not the first person to say that. It's funny
I'm the first person to say that?
No, you're not. And it's funny because, I think we can probably all agree, when we were in school, you're hearing the horror stories of the chronic pain population, how they're so hard to treat. But you're now probably the third therapist I think I've talked to who's these are my people. These are the people I love working with now.
Yeah, I mean, you've had Deborah Sheldon on here. She's my pal. We presented at CSM together on CRPS. So I'm sure she's probably one of the people who would say
she is one of the, yes, Deborah is definitely one of the people.
I started an adult outpatient ortho right out of school, and I did that for 2 years, but I was working at the clinic that the owner was also the athletic trainer for the Seattle Storm, our professional women's basketball team, if you don't know who they are. So I worked with the Storm for my first 8 years out of school as well as their physical therapist.
Dang.
And then so I would it was funny because at the beginning I was seeing adults, and so it felt very similar. And then I transitioned to pediatrics, and I would see an ankle sprain in a 7-year-old from the playground. And then I'd go to basketball and have a professional player with an ankle sprain. Just the juxtaposition and the difference was really awesome.
Could you ever tell the basketball players, like, I'm working with a 7-year-old with an ankle sprain and she's tougher than you? Maybe that wouldn't go over
Usually
well.
I would say they're doing a better job of sleeping and hydrating.
Yeah. Wow. What a cool dichotomy you had going on there of working with. It sounds like for a lot of your kids, it's just kids being kids getting hurt. But at the same time, I don't want to call those kids not athletes. I remember running around the playground as a kid. And it's funny when you were talking about that girl with the PCL tear. I'm like, I remember the playground we had at my elementary school. And I can't believe no one died on that playground.
Right.
Like, it was so awesome, but at the same time terrifying and I'm sure completely unsafe. And then to move to this transition of the professional athletes, I got to ask you this question then, Abby, because a lot of us, myself included, go into PT school being like, I want to work for XX professional team. And then quickly kind of realize, like, okay, that's probably not actually going to happen. Is working with those professional, those highest level athletes, like, I've heard stories about how they're just kind of divas or they're really hard to work with or things like that. What's it like? What's it like going back and forth between those two clinics, those two worlds?
Yeah. I mean, I loved it.
Good. I'm glad you did.
I think it's funny because I have just as many teenager divas in the clinic that are 12.
Yeah. Fair.
As you, like, there's one in every group, isn't there? But also just, I think what we don't emphasize nearly enough in PT school is the benefit of therapeutic alliance and personality.
Ooh.
One of the things that I've kind of said, and you mentioned I have a book that I'm working on. When I think about myself as a physical therapist, I don't ever think that I'm the world's greatest physical therapist, but I think I'm really good at connecting with people.
Okay.
So I prioritize therapeutic alliance almost so much that it could be a fault that I can get along with so many people. And that doesn't mean I can get them all to do what I want them to do.
Yeah.
But I do find that I can make them more comfortable, especially when they're having all this pain.
Mm-hmm. Oh,
so
absolutely.
I can usually find a way to connect to get them to do some of the things I want them to do that I think are going to make them feel better.
Oh, I 100% agree with you, Abby. And I also lean so far into that therapeutic alliance camp that it's probably bad, but I'm sticking with it until someone proves to me that it's wrong. You know, for a kid, I'm bouncing back between the two worlds that you described of pediatrics and professional athlete stuff, that all of a sudden hurting themselves so that they can't participate with their peers and do the things, even if it's simply like, I want to go play on recess. Like my daughter, I have an 8-year-old daughter. Recess is a big deal, you know?
It's a big deal. And they have it 2 or 3 times a day.
Yes. And so when she can't do that, that's very hard. But taking it to the other end with the professional athletes, this is their livelihood, their job. And so I can understand that's a whole different mentality when you're working with that. How do we get you back to being able to do your job? It's not like they're playing basketball in a weekend league for fun. This is where their paycheck comes from. And I can imagine that requires a very different set of skills in terms of making those connections, but we got to be able to do that. I talk to my students about this all the time. Like, you got to be able to reach your audience, and your audience is going to be wide and varied and have incredibly different needs.
Yeah, I think the people making the decisions are different too. So part of my therapeutic alliance biases and beliefs are that the child is the patient and should have some autonomy, especially over their bodies.
Yeah.
There have been times when I've had a post-op day 3 who is really scared and having pain, and they don't want me to touch their surgical leg. If mom is there saying, you need to let her touch your leg, I don't do it until the kid lets me.
Yeah.
And like the rules
that.
say that if the parent gave me consent, I can do it, but I'm not willing to cross that line, even though I have the permission, until the person who I think should give me the permission does it.
Yeah, exactly. Because yes, mom may have said it's okay. Kid's not going to like it. And you're certainly not building rapport with your patient by doing that.
Even more favorite to me is watching the interaction between the parent and the kid and being like, actually, I think this is going to go better if you just leave the room.
Do you say that sometimes?
I do. And my coworkers and I all have different opinions on this. I try to be really nice. I don't usually do it on the first day.
Yeah.
But kids act very differently around their parents.
Yes, they do.
Some of them, it's like anything I accomplish, I look back and be like, look at me. And some of them do not want to interact. Mm-hmm. The dynamics change so much that it's more fun to see what they're like on their own when they make the decisions. They tend to make the best decisions on their own.
Yeah. It's got to be a tough kind of line to walk in a pediatric realm when you are dealing with minors. Like, you have to still involve the parents legally in some of these things, but how do you do it in a way where you don't necessarily have a helicopter parent who won't allow the child to actually voice an opinion or whatever it might be? Interesting.
Yep.
So interesting.
It's fun.
I have 3 kids. I have twin boys who are almost 14 now, and my 8-year-old daughter. They've all gotten into their scrapes and bumps and things like that. They've never had to go to PT so far, but my daughter did break she had a distal fibular fracture and had the cutest little walking boot. I have a video of her dancing in that thing because, she didn't let it stop her, but I'm like, oh my gosh, that thing fell apart when it was finally time to take that thing off.
Yeah.
Okay. So let's talk about this book.
Oh, yeah.
What gave you the idea to write a book? And we're not talking about like a textbook. Tell us a book.
No, definitely not a textbook. I have been writing for a long time. I have a blog that is nearly defunct because of the way the world has gone. But for a long time, I was blogging and I really enjoyed it. The reason I started blogging was that I found myself attending better continuing education courses and not having a good way to organize what I had learned so I could save it to look back later.
Sure.
I found myself with notebooks all over my house being like, I can't find anything. So I started doing that for that purpose. Also, because I was working for the Storm, I was getting maybe 5 messages a year from people being like, how did you get to be in this role? How do I get there? And so I wrote that as a blog post to be like, here's the story, and then I'm happy to answer any questions, but I felt like I was just telling it over and over again.
Sure.
So it was fun to just kind of be able to write it and then share. And I was writing already, and then when my role with the Storm ended, which was related to contract negotiations with medical facilities, they built a brand new, beautiful practice facility, and they have a medical sponsor. I work for Seattle Children's, and their medical sponsor is a different hospital network. I hope that someday I can convince them that they don't need to partner through their hospital. There's a company called The Next. They are an online news publication that covers women's sports.
Okay.
The Next itself is all women's basketball. They have one other physical therapist. His name is Lucas Schaefer, and he was already doing some coverage on WNBA injuries, but I had been in contact with their editor-in-chief and just said, hey, I want to keep writing and being close to basketball. And so we partnered and I joined their crew. And so I've been writing. And then I started getting a little bit more into writing as a career.
Mm-hmm.
That's been really interesting. I started jotting down ideas for what a book might be. And so then this one happened, and this book, and I have a list, so it's possible I'll do more than one. We'll see how the first one.
Why stop at one?
I know, why stop at one? Every time I see F. Scott Thiel, who I know has also been a guest, he's like, what are you doing as your side hustles this week?
Yep.
When are you writing a book? When are you starting a class?
Yep.
So I've talked about doing something like this for a while. And so the book is It Depends, is what it's called.
Love it.
Which is something we face in PT all the time, but it's not specific to PT. There's some PT specific in it, but it's more like, here's a scenario you might encounter in life, and what does it depend on? Yeah. I'm expressing what it depends on for me, but with full understanding that it might totally differ for you. Yeah. So should I quit my job is one of the chapters. Ooh. And talking about all of the things that led me to quitting my first job and joining Seattle Children's and the reasons why I stay now. And then pointing out that I don't have 3 children. I have twin niece and nephews who I care about very much, but I don't have to worry about other people when I pick where I'm living, where I'm working, what my schedule looks like. If I want to work in basketball and travel, I can, and I don't have to worry about that impacting others. So it's been fun to just think through how I think, because usually I find when I'm in any sort of argument, I'm not thinking the same way as the other people in the room.
Well, I like how you're describing it. Like, this is what I did, and this is what applies to me, but not indicating this is what's going to apply to you. It's funny. I literally have a shirt. I got it from Jimmy McKay at PT Pinecast that just says, "It depends." And I wear it for my students and they hate it. But I've never met a PT who doesn't get that joke. Like, right. I don't know why we all know that joke, but I like that you said it depends on, because telling my students, well, it depends. And they're like, well, great. But to say it depends on these next factors, that's really where the critical thinking skills come into play and where a lot of the growth happens for our students. But they do not like having to go through that growth pattern sometimes.
It's hard.
And I know I didn't. I mean, now. I can't say that I enjoyed it. Oh my gosh. Yeah.
Yeah. There is some research supporting some of the things that I'm saying in there, for sure. I have some of the really interesting research about Therapeutic Alliance because I did talk about Therapeutic Alliance in it.
Yeah.
But yeah, the book, it's not done yet. I'm actually meeting with my editor today, who is Sarah Cruiser. Has Sarah Cruiser been on your podcast?
Sarah Cruiser was our last guest who told me, it's like, you need to talk to Abby.
That's so funny. We're friends. And I know she
Yeah.
edited Rebecca Griffith's book, The EDT.
Yeah, I didn't know that. Yeah.
That one is top of scope, which everyone should read. And I'm pretty sure she also edited Nick Hoop's book. He's been a podcast guest for you.
Nick, going back.
Goldberg, about insurance, which I have not yet read, but I'm sure I will at some point. So
Nick's
Sarah's gonna
episode,
be
I think, is our most downloaded episode.
That's awesome.
Which rightly so, because it's a great episode. Nick's a great guy.
So Sarah, there's my
wow.
plug for Sarah to be the editor for all the PTs who want to write books.
Okay. Well, I'll let her know. I'll put a little tag in the back, like Sarah Cruiser, editor to the PT Stars.
Love
That's
that.
funny. Yeah.
But yeah, and also
okay.
I had been writing already a little bit, and I had an outline of topics that I thought it depended on stuff. Then I went to the Elite Basketball Rehab Conference hosted by Eric Mura. He did the first one 2 summers ago, and that one is really cool. It's all based on basketball injuries, and they do it in Vegas during NBA Summer League. So all the NBA medical providers are there, and then
Nice.
there's like a get-together networking event, and you can meet them all, and he brings in really great speakers. And Jared Boyd, who is the physical therapist for the Memphis Grizzlies, gave a talk that talked about it depends. And so I'm going to hopefully convince Jared to write the preface to the book.
Oh, nice.
And we'll see if I can pull that off. We've been in discussions, but he wants to read the book first.
Fair.
I thought that was fair.
Yeah. Okay. I might have to reach out to Jared Boyd. Honestly, it's how I get my podcast guests. Is the next one's like, oh, you should talk to so-and-so. All right, cool.
Yeah.
I'll go talk to him.
Just bring me
Nice.
on and I'll name drop a bunch of people.
Yeah. Well, it's funny that you mentioned Rebecca because she's a good friend of ours as well. I describe Rebecca as the switchboard of PT. She will connect you with everybody. It's kind of crazy. Wow. My wheels are spinning because I have my own research and writing projects. Listening to you, I'm like, okay, I should do this. I should do this. It's great. I love it. Let's talk about teaching a little bit.
Okay, let's talk about teaching.
Let's talk about teaching. So you recently mentioned that you are an adjunct faculty. The Tufts program, has it started in Seattle?
It did, yeah. The second cohort will start in the fall. So the first one is
Okay.
almost done with year 1. And I was adjunct for the anatomy class, which is one of their first courses.
Oh, yeah.
It was really fun reviewing anatomy after a decade. I actually really liked it. There's almost 75 people in this first cohort. And the professor who's teaching anatomy is Sarah Gilliland, who I had never met before. She is teaching it in a very functional way that is not how I learned anatomy in PT school. I did the memorize your origins, insertions, and actions and spit it out. My teacher was great. We're friends still. So that's not a knock. I don't know if she still teaches it that way, but
yeah. But that's how most of us probably learned it.
Yeah. And this was so different. And I'm not sure if I found it easier because I've already learned anatomy.
Yeah.
And used it, or if it is that user friendly. We're going to talk about a push-up. And let's start at what the arms are doing in a push-up, like the bones of the arm that are included and what they are, and then what muscles are involved and like what actions are they doing. And of course we need to talk about the nerves. So it was segmentally done, but applied to a movement. And I just embraced it.
I like that. Anatomy is a subject for our students where I teach as well. It's their first class. Oftentimes it's kind of a bear. It's because I think part of it is the transition to grad school, the pace of grad school and things like that. Yeah. But it's tripped up a few of our students, and I wonder, I don't know enough about our class to know how it's taught, but I'm guessing it's taught more in the model that you and I probably experienced as students, like memorize these bones and these muscles and these nerves and blah, 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 blah.
And as an adjunct, I'm attending labs and focusing on how the lab is structured. I did watch lectures, and there's part like that, but it still felt more function-based. But so then what she did was for the labs, she broke it down into certain body regions for us to do the palpations. We did human palpation on each other as well as models and identifying structures. I was assigned the brachial plexus as the part that I was going to teach.
Oh, you poor thing.
If any of your listeners don't know what the brachial plexus is, I'm going to say it's the most complicated thing in all of anatomy to learn.
Oh, it looks like a subway map or something like that.
Yeah,
it's the
we
worst.
built it with pipe cleaners. It was so much fun. So like
That's
every
brilliant.
group of 10 kids, I want to call them kids because I'm now enough older. They're obviously these are young adults, but each group we built it. And by the end of it, I was like, it was like a performance. I was like,
That's
here's how we
amazing.
build the brachial plexus.
That's amazing. I want to do that.
It was really fun. I'm next going to be teaching cardiopulmonology, which is way outside my general care area of practice. But the professor for that is Dr. Jenny Jordan. I don't know if you know her, but she was APTA Washington's president for a few years.
Okay.
She's an acute care PT. She's been teaching at Eastern Washington and now will be at Tufts. We're friends, so that's fun. But when I signed up for cardiopulm, she's like, if we get other people who actually do acute care, are you going to be okay with me bumping you? And I was like, I can manage lines.
Yeah, that's funny. That's hilarious. I help out to teach our intro acute care class. You know, I have a little bit of acute care clinical experience, things like that. And it's one of those things where I have to remind myself, I know more than the students do. I'm certainly no expert, but I know more than they do, at least. I can
really
operate
good
a
at
hospital bed.
furniture.
Yeah, exactly. So it's funny, but I would not feel comfortable running one of those classes. Okay. So you're kind of dipping your toes into the academic world. Is this something that you want to, or maybe could foresee transitioning to full-time, or is this just kind of fun?
I really like giving one-off lectures, which I've had a pretty decent amount of opportunity to do. I do it at work a lot, and then I have done some smaller conference things. I think, yes, I love clinical practice, but I don't know that in 10 years I'm going to want to squat as many times a day as I do.
Yeah, I hear you.
And the hardest patients, like yesterday I had a 6-year-old patient, and just the amount of running around in that one patient care session is a lot. Some days I'm like, I don't know if I can do this past. I don't know how old I'll be able to do it. I hope that this is keeping me active more than other jobs would.
Yeah, that's a fair question. In certain categories of PT, pediatrics being one of them, are physically demanding. And, you know, I'm certainly no spring chicken, nor do I have a lot of healthy joints. So I got to be very careful. Being in academia does help. I can just sit down in my office and things like that. But even when I'm running labs and stuff like that and teaching my students on, you know, helping a patient move, doing transfers and stuff, I got to really think about it and make sure I'm not going to hurt myself. So
yeah, we definitely have those conversations with anatomy where the table's really low. And I'm like, I realize this is just a skeleton model, but like raise the table.
Oh, doesn't it just like make your back hurt watching them? You're like, oh, come on, just do it. Just raise the table. We paid a lot of money for these high lows.
One of my patients told me that the high-low table in my clinic was the worst amusement park ride they'd ever been on. I was like, are you saying that I've been making you go up and down too much? And she was like, yeah, but I'm not getting sick because it's so slow.
That's hilarious. This just reminded me, when I was in PT school, one of the professors had a tradition of, if it was your birthday, you would come up to the front of the class and stand on the high-low plinth. She would raise it all the way up and raise it all the way down as everyone sang happy birthday to you. It was a weird little tradition. And a classmate of mine and I had the same birthday, so we both got to go up onto the plinth. I'm 6'4". I'm a big guy. She was, you know, very average height woman. And so we're both kind of standing like, oh, this will be fun. And we go up and I realized I'm going to hit my head on the ceiling. She keeps going up. And the professor, she was hilarious. And I think she knew what was going on because she had this very devilish look on her face like, hey. And so I'm like, yeah, okay, that's enough. I'm done. Anyway. All right.
I did want to talk about one thing that I don't think we talk about enough in PT.
Do it.
Because I attended a class this past week, and this is the third time that I've attended this. I provide support as a group facilitator. The class is about weight-inclusive care in healthcare.
Okay.
So the one that I'm attending it's a physician and then a researcher who researches weight-inclusive care. It's through the University of Washington, where University of Washington has all of their medical, every specialty, like nursing school, medical school, PT, OT are invited to attend. And they have a list of like optional courses that they have to choose 3 of these topics.
Okay.
And one is probably race-related care or DEI. This one is weight-inclusive care. Some of them are about financial, they're like social determinants of health. And I'm not sure what the whole list of classes is, but they have like 8 choices. Okay. And this one is weight-inclusive care. And so it was a whole group. There were 100 people.
Wow.
And they bring in some of us who are already in practice to help with discussion groups. after they do the didactic course. The didactics are explanations on the data that show how we negatively impact people when we talk about weight and where BMI came from and what we're using BMI for, but really what it was not intended for. I like bringing this up as a topic sometimes for us to talk about because in physical therapy, this is something that directly impacts a large amount of our patients. And also, as a larger body, I'm a large bodied physical therapist, and we don't have a lot of these. And it is a very hard profession to be big in. So I constantly find myself in these interesting conversations with doctors. I'm working in pediatrics. If you tell my 12-year-old that they need to lose weight because they're having knee surgery, I'm going to really struggle with that. Of course, I support healthy living behaviors. I support being active. I support having varied nutrition. But I also think that we're detrimentally affecting people's mental health in a way that is just so sad. So I attended this course, and I think my favorite part of it was that it was interdisciplinary. There was a dental student in my group. There were 3 nurses, some mental health providers that were studying to be social workers and therapists and medical students. And the organizers provide you with a case that they want you to discuss. And the case that we had happened to be a child who was having knee pain and who is big and who recently was found to have multiple cavities. And so I just thought it was funny because we had a dentist in the group who was like, has anyone talked to the family about the frequency of them brushing their teeth? Like, why are we jumping to the kid losing weight? That's not going to fix their dental problems.
Yeah.
So just a really interesting group of people. And I have had it happen. I'm sure that this happens in sports because I've experienced it also, where an elite athlete would rather see somebody who looks fit for their training.
Absolutely.
But my favorite is in the clinic, where I have some really amazing coworkers who happen to also be thin and fit, and the patients don't want to see them because they don't look like them.
Yes, it goes both ways. I've heard stories going both ways, like you just described.
Yeah.
What I was going to say earlier, I didn't mean to cut you off, was that this is a topic that's been in the periphery of my radar for a while. I went to a discussion group at CSM when it was in San Diego about ableism in the profession in physical therapy. Whether we want to describe it this way or not, we are an ableist profession. It's just the nature of the beast. And this discussion group was specifically talking about therapists with disabilities like visual impairments, hearing impairments, things like that. But even so, the idea of body size and morphology, I think, can be included in that, just for the exact reasons that you just described, Abby. Like that there's this perception, true or not, I think, in PT of like, you know, these are the fit people. Patients might expect a certain thing from their therapists because of that. And I also think that I've learned this being in academia. We've had some students come through with some rather profound physical impairments and trying to figure out how can we still teach them, how can we help them be successful, and just because they have this disability, does that mean they're not qualified? It's really interesting if you dive into some of the requirements for licensure, it's very vague. And I think it's easy to assume, oh, you have a significant visual impairment, but you're not going to be able to be a PT. Well, no, that's simply not true. When I was at this group, it was very interesting. There was a student there, a third-year student at the time, who had her guide dog with her. I think she could see a little bit, but was legally blind, but was talking about, her research was talking about kind of ableism and things like this. And there was another therapist there who was a practicing therapist who was also legally blind. And the student was like, I've never met another person who is legally blind who is a practicing like, it was the first time she'd ever connected or seen someone else who had the same kind of circumstances as her. And it was a very powerful moment because it's been a challenge. I think it's easier to say, oh, you can't do it because you don't fit the mold of the standard PT, rather than figuring out, okay, you have different abilities and needs and limitations than someone else, but let's figure out how to make it work. And if you think about it, isn't that what we do for our patients all the time?
Yeah.
Isn't that just how we do things? I don't know. I can pick a million different examples, but my clinical background was in traumatic brain injury rehab. And a lot of the patients I worked with were like, you got into a terrible car accident, you just got smashed to pieces. And now I'm trying to put things back together. It's like, yeah, you're going to have different abilities afterwards, but it's not like I'm going to tell you, well, you can't run a 7-minute mile anymore. So bye, I'm not going to work with you. No, we just don't do that. So why do we not allow that same grace and same kind of ideas towards our colleagues who have different abilities? I just don't get it.
Yeah. I think we've just become a society where we decide how everyone else should look or what they should be able to do. And really, the only person who should get to decide that is yourself.
Yeah.
But we for sure have faced, there's physical therapists who work also in strength. I mean, I'm also a certified strength and conditioning specialist. So there are some who are going to say, like, you're not fit if you can't deadlift 2 times your body weight or bench press your body weight. And great, you have targets. Yeah. And some people are going to achieve those, but I don't really like that we're using that. There becomes like moral judgments applied to this.
Oh, yeah.
Of good and bad. And honestly, isn't it just working to be the best version of yourself every day?
Yeah.
Doesn't everyone want that?
Mm-hmm. Yeah. If you're a therapist on Instagram and you say something like, you're not fit if you can't do this, please stop doing that. Just please stop. Just don't be that person. Because I'm like, I don't think I could deadlift 2 times my body weight. I don't know.
Well, and like our PE teachers, I don't think the teachers are deciding this. I am a full supporter of teachers in general, but there is a issue with like the kids have to run a mile and they don't pass PE if they don't hit it in a certain time or they get a lesser grade. Why isn't it they completed the mile so they passed PE? Like, yes, we all want to improve. I'm sure they also want to do better. But for some of them, I face this usually with the patient had knee surgery. We're clearing them to start running and they've lost many minutes off their prior mile time.
Yeah.
So they might not even be able to finish because they have no cardio endurance, which is another problem we face in PT of like, we can't really prioritize doing cardio in our sessions when we have to focus on the injured body part. So then it's like, if you don't have access to a bike at home or a pool to swim in, you're limited in how quickly you can get this stuff back. But then we're going to grade you on it in school. That's so sad. And I'm just like, yay, you finished a mile. It's your first time. And they're like, yeah, but I only got a B because it was supposed to be under 10 minutes and I did it in 12. I feel like maybe there's a way you just give people bonuses and don't worry about it. There's got to be a better way.
Yeah.
Stop shaming the children.
Yeah. PE is it's funny. I was actually a physical education major in college. I was going to be a PE teacher and didn't go down that route for a lot of reasons, but it's funny to think about what our experiences as students in those classes were like and what they are now. It's a very different game now, but it's still there.
Yeah. The most power I have as a physical therapist is writing a person a note to get out of PE class.
Nice. All right. I like that.
With great power comes great responsibility.
Nice. So how many storm games do you get to a year?
Now that I'm not working with them, probably 5.
Okay. Did you get free tickets before?
I still tend to, just because I'm still friends with people who work there. I usually get free tickets. When I go, I usually try to go to a game on the road. If I can't, like, not with them necessarily, but like, I worked for the Connecticut team before Seattle, before I even went to PT schools. I usually go to a game if I'm home with my family. My brother lives in Washington, D.C. We've gone to games there. I have enough WNBA fan friends in different cities that if I'm going to be traveling, I might be like, hey, there's a game. Do you want to go? And it doesn't really matter who's playing.
Sure.
But yeah.
I just saw, I'm in Michigan, and I saw that there is a ownership group that's trying to bring WNBA back to Detroit. So.
I saw that announcing expansions. Cleveland will be added.
Really?
It looks like. That's one of the newer announcements. I don't know if it's been signed and finalized, but it did say Cleveland was likely front runner.
Okay.
So we'll see. But when there was a team in Detroit,
a title,
when I
didn't
worked
they?
with the Connecticut Sun, we used to come to Detroit and play at the Palace at Auburn Hills.
Yep.
I loved coming there. My family would come visit because I have family in Ohio. So
didn't they win a title?
The Detroit Shock did, sure. Probably more than one.
Maybe.
I don't know how many, though.
More than the Pistons recently, we'll say that. Abby, thank you so much for your time here. If people wanted to find you, could they find you? Where would they find you?
You could find me anywhere. I'm on probably all the social medias, maybe too many of them. My username is agordon55 on pretty much everything, I think.
Okay. I'll link to some of those things in the show notes.
Yeah, I'm on LinkedIn. I'm on socials. Email is easy too. You can just send one, abby.gordon@seattlechildrens.org, and you can find me too.
There we go. Awesome.
And if people want to bring a weight inclusive care course to their PT programs, I will connect you, because this group was great, and I'm sure they could modify it to PT specific if that is something of interest.
Nice. That's awesome. Well,
I'll look for it. Depends. Hopefully.
Yeah. Oh, yeah. It depends. Hitting the bookstores. Do we have a tentative date?
I'm hoping by the end of the year, like summertime, we'll be done with editing and figuring out how to publish. So for sure in the next.
Just in time for all those Christmas wish lists.
Yes.
Nice.
Love that idea.
Yeah, there you go. Very cool. Awesome.
Thanks,
Abby,
for
thank you
me.
so much. It was great talking to you. And hopefully we'll actually get to meet in person at a conference or something like that someday.
Yeah, let's do it.
All right, cool. We'll see ya.
See ya.
Dr. Abby Gordon is a physical therapist, educator, and author in Seattle. She will happily talk to you about the WNBA. Waves is a production of APTA Michigan. It is hosted by me, Andy Wicks. Editing help from Joey Lapidi. We can be found online at www.aptami.org or on the socials at APTAMI Waves. Drop us a line and say hi, or tell us who we should talk to next. Don't forget that if you're a PT or PTA in Michigan, you can earn license renewal credit just by listening to Waves episodes. See the show notes for all the details about today's episode. Thank you for listening, and may your documentation always be done on time.